More than 40 million people in the UK have now had their first COVID jab. But many developing countries have barely started their vaccination programmes, and that has renewed calls for a coordinated global response to tackle the pandemic and stop the spread of variants which might emerge in countries where they're not vaxxed.
And which will, in due course. We know that's going to happen. It's coming at us down the tracks. So let's look at some figures here. In the UK, 76.6% of our population has now received their first dose. And over in the United States, more than half have had their first jab.
In India, just over 12% have been vaccinated. That's 220 million people in a population of 1.3 billion. The country still has more than 100,000 daily infections. Peru currently has the worst fatality rate in the world, and its vaccination rate is just 8.52%.
Now, the Olympics in Tokyo are still going ahead next month, despite Japan experiencing a fourth wave of infections there, and only 8.69% of the population having been vaccinated. And apparently over 80% of Japanese people don't want the Olympics to happen. And in South Africa, where a variant of, as they say, concern originated, infection rates have been steadily climbing amidst their third wave. But vaccination rates are low, at just over 1%.
Well, ahead of the G7 in Cornwall this week, the former Prime Minister Gordon Brown is urging wealthy nations to pay for the majority of vaccine programmes in developing countries to support their effort to fight the pandemic. And he joins us now from 5. Very good morning to you, Mr. Brown. It's always good to see you on the programme. It's very interesting watching that graphic of how countries are doing across the world, because actually it's not just developing countries who are so behind on vaccinations. So how do we help other countries get up to speed? Is this not a national government problem rather than our problem?
Well, Susanna, you're right. The thing is that nobody is safe till everybody's safe. It's not going to be over, as Richard just said, until it's over everywhere. So we do, in our own self-interest, want to make sure that the rest of the world is vaccinated. If it mutates and comes back to Britain in another form, and even the unvaccinated are not protected, then we will pay a very heavy price economically as well as in deaths. So the question is, can we have a plan, just as we had a British plan, can we have a global plan to get people vaccinated? Because there's only a few manufacturers around the world, but there's 194 countries. And what I'm saying is on Friday, you've got the richest countries meeting around the table in Cornwall. This is the one place where you can make a decision. If they said, on the basis of our ability to pay, we put up 2/3, then get Russia, China, the other oil states and everybody else to put up the rest, then we could fund the vaccination, then get the manufacturing capacity built up. We need 10 billion vaccines a year, and then, of course, get it manufactured in every continent so that we can distribute it very quickly to Africa, where 0.2% of Africans' population, that's sub-Saharan Africa, have actually been fully vaccinated. 1 in 500 so far, and that's just not good enough if we're going to protect ourselves as well as them.
I heard you talking about this very topic about a week ago on Radio 4, Mr. Brown. I was very impressed, actually, at the way that you were pitching it. It was very Churchillian, actually, if you don't mind me saying so, because you were basically saying, and you've just said it at the beginning here, it's kind of action this day. This G7 conference is an opportunity to make this happen. How confident are you that you can pull it off?
Well, Richard, you're right. It's a life and death meeting. You know, we are deciding who lives and is vaccinated and who is not vaccinated and is at risk of dying. So Boris Johnson's the chairman. I've suggested a plan to him. It would get 10 billion vaccines manufactured over the course of the next year. It would allow us to manufacture and then distribute to almost everybody in the world. It costs about 30 billion a year. That's about 30 pence per adult and person in the United Kingdom per week. It's quite a small price to pay to be protected. And of course, if America pays, Europe pays, Japan pays, and then of course China, Russia and the oil states pay, then we get to 100% of the cost. It's not a huge amount given the losses we're having, and given, by the way, that Britain's about to get a funding of $23 billion from the International Monetary Fund. That could help pay for this 6 or 7 times over.
So let me put a couple of things to you, because it's a similar argument to the argument over the cut in international aid. There are people who would say other countries have to get their own houses in order. Our first priority is to protect people here. And you may have to make a trade-off between vaccinating younger people, for instance, from the ages of 12 up, and not put the money into vaccinating other countries. The other thing is, our whole ethos throughout this pandemic has been to protect the NHS. We heard Dr. Hillary saying earlier that NHS staff are absolutely on their last legs. We haven't had treatment for, or even consultations in some cases, for other conditions. That sort of money you're talking about could be injected into our NHS in order to solve and ease the problems here. So how do you argue against that?
So look, Susanna, if children need vaccinated, and that's the medical advice, we must do it. I know that they could still, even if vaccinated, pass on the disease, but of course it gives everybody greater protection. If that's the medical advice, we do it. And of course we've got to fund the NHS properly, and I feel very sad that the nurses and the health workers have not been properly compensated for the work they did over the last year. But we can do both. And it's in our interest to do both. If we don't help vaccinate the world, it will come back to haunt us. But if you look at the monies that are available, I said 23 billion from the International Monetary Fund, that's about 16 billion pounds that's coming to Britain in the next few months. Equally, we've just announced a tax programme that will raise more money from the global corporates who are not paying their fair share of tax. So we can afford to do it, and we've got to do both. But as I say, the plan is 10 billion vaccines around the world. Yeah. If we could do it for Britain, the world could come together to do it for the world. But you need a collective effort. Some countries can do more on their own, but some countries don't have the resources, and we've got to understand it's in our interest they're vaccinated.
But yeah, just to emphasise that very last point there, what you're really saying is we're not being altruistic here. To some extent we are, but that's not really our motive. Our motive in getting other countries fully vaccinated, is to stop variants developing there. And we know it's a tiny planet, and this bug travels with lightning speed, and we could find ourselves in as bad a position in a year or two from now as we were last March. That's what you're saying, isn't it, in effect?
Richard, yes, it's self-interest, it's self-protection. It's probably, as the International Monetary Fund said a few days ago, the best insurance policy in the world, because we're all going to be afraid until nobody's afraid of this vaccine hitting them, and it's got to be eradicated in every country so that it's eradicated in every part of the world and it doesn't come back to hit us again. So yes, it's in our self-interest, and actually there's a poll that we brought out today, 79% of the British public and only 21 again say that it is better for us to pay our share of vaccinating the rest of the world, because it's in our interest to do so.
All right, Mr. Brown, thank you very much for your time. And something you didn't repeat, but you did say in the interview I heard you do last week, you said, let's never forget that this started in one country. It started in a single country, and in a single town in that country, China. So, points well made. Now, should we vaccinate children here in the UK, as we were just talking, after the Pfizer jab was approved for 12 to 15-year-olds, or should our stock of vaccines aid the global vaccination programme instead? Mr. Brown says we can do both. Yeah, so let's pick up that debate with Professor Adam Finn, who is from the Joint Committee on Vaccination and Immunisation. You're a paediatrician, aren't you, Professor Finn? Professor of Paediatrics at the University of Bristol and head of the Bristol Children's Vaccine Centre. Says we shouldn't be vaccinating children unless we really need to. And the chair of Global Public Health at the University of Edinburgh, Professor Devi Sridhar, who says if the jab has been approved, we should use it on children. So very good morning to you both. Professor Finn, just want to pick up on something that the audience will see on screen, which is you are in Portugal. Are you planning to get out before it turns amber?
No, I've only just arrived and got a lot to do here before I can leave. So, yeah, I'm not quite sure when I'm going to manage to get back.
You face a quarantine when you do, because, of course, we have this confusing situation, don't we? You're legally allowed to go to Portugal, of course, but the government's saying don't, and you have to quarantine when you come back. So, as somebody who looks after children, why do you think there is an issue over vaccinating 12 to 16-year-olds?
Well, I don't think there's any immediate issue around it, since the vaccine is now authorised, and the studies show that it's highly effective in children, and at least as far as we know, a safe vaccine to use. So the issue is not that there's a problem doing it. It's just a question of whether we need to do it, given the very low incidence of serious illness in children, And the fact that we're achieving so much with the adult program at the moment with very high coverage, so that if indeed it turns out that children can be indirectly protected by the immunity that we induce in adults, then there's clearly no justification for immunizing, or at least immunizing all of them. So we need to really work out what the needs are before we make any decision.
Well, what do you think they are?
Sorry, Richard, I just wondered if you just clarify that for us. How affected are children, particularly by these new variants?
Bit hard to say regarding the new variants. We've started to see some cases in children, including in schools in Bristol, and we're looking very intensively this week to see if that's spreading at all. But broadly speaking, children, it's one of the small mercies of this epidemic. Children are very mildly affected when they get this infection. Very few of them get seriously ill, and for the most part, they're actually not that infectious to others or to each other, as compared to other respiratory viruses, where that's quite different, and we see lots of transmission going on in childhood.
Sorry, I just wanted to nail you down on this, because you're being a little bit equivocal. Are you saying actually definitively that you don't think we should proceed with this vaccination of children as things stand?
No, I'm not at all. I'm saying that we need to be driven by the evidence and decide whether or not to immunize children when it becomes clear whether that's actually something that's needed. And at this point, we're not sure about that.
All right, well, let's turn to the Chair of Global Public Health then, Levi Sridhar. What do you think?
Well, I've been working on schools for the past year, and if we want schools to continue without disruption in the autumn and lift restrictions so children can have a normal experience, we need to vaccinate them. And if we wait and watch for the evidence, it'll be too late in the next few weeks. We know already the United States is racing ahead, vaccinating those who are 12 plus. We know Israel has done this. We have the supply. It's not a large amount. It's a couple million doses to cover that population of 12 plus. And actually, we can't use AstraZeneca, the main supply we have, in those, in younger age groups. So we should, export AstraZeneca, help countries abroad, send those doses, help manufacturing capacity in other places, as well as focusing on our adolescents to make sure they don't have another year disrupted, because that would be an absolute shame.
Professor Sridhar, what about the point that children are less affected, and when they are affected, they're much less likely to be seriously affected? That something about their immunity or constitution means that they're much better able to shrug off COVID. And therefore, giving them an immunisation against it is potentially a waste of an immunisation we could send abroad.
Well, I think the thing to remember is that children can still get long COVID and can still be chronically ill from this. And the thing we've learned is also we constantly are seeing new variants, and we don't want to leave a large segment of our population completely susceptible to a new virus. I agree with Dr. Fauci in the United States. They're having the same debate there. And what he has been saying is that given that we know children can transmit, where we are going to see problems going forward is not going to be in care homes, it's not going to be in hospitals, it's going to be in schools. Because this is where you're going to see large groups of unvaccinated kids together, and we are going to have outbreaks. And then the question becomes, do we keep sending kids home and having bubbles isolate, or do we say, let it go? And if we say let it go, what are the ramifications at a population level? So I think we need to kind of be really serious about what this means for the autumn.
The main point, it seems to me, from your argument here is that notwithstanding the fact that children tend not to be particularly badly affected by it, they can transmit it. And as you say, if there are variants and the kids still haven't been vaccinated, they will become a potential seedbed for infection in the wider community. That's the problem, isn't it?
Exactly, that's exactly right. And the thing I want to mention is that it's not like, it's a huge number of doses. We're talking about a couple million kids, 12 plus. It's a different debate for kids 12 and under. And so we might as well just do it, roll it out this summer, get those kids covered so secondary schools can go back normally this autumn. I think it'd be a huge shame if we're back in blended learning or having kids doing home learning in the autumn because we can't then figure out how to manage infections in that population and still focus on the wider world. I mean, if you look at India, Brazil, Russia, they're going to need millions and millions and hundreds of millions of doses. And so our covering a few million is a drop in the ocean compared to the greater needs. So we should cover our kids and then still help the world. And as our pandemic ends, not forget that the wider world pandemic is still raging.
All right. Good to talk to you both, two professors. And good luck, Professor Finn, in Portugal. And I hope you get back safely. Thanks both very much indeed. can imagine a lot of parents at home going, please, let's not go back to home learning.
Absolutely.
Whatever it takes.